So my name's Anne-Marie Baird and I'm one of the patient advocates on the Lung Health Check Steering Committee. So as part of the Lung Health Check programme, patient advocacy has been key from the very beginning. So myself and another patient advocate, Seamus, Cotter, have really been involved from the very start of this programme in terms of trial design, how to engage participants, what is the literature going to look like, the video, all of the different things that come together to make a successful lung cancer screening programme. And it's just been a real privilege to work with such a large team to bring it to fruition. And I think for myself and Seamus, what was really key is that we had open and honest communication with the team, and we felt really valued members of the team as well. So my lived experience with lung cancer is that I've lost 2 family members to the disease, and I can't not but think if there was lung cancer screening back then or a lung health check programme, how different it could have been for my family and for my loved ones. So that was really a driving force for me to get into patient advocacy, specifically in lung cancer. And with that, you bring the personal experiences that you've had, but you also bring the motivation, the passion to really say we need to do something that's going to translate into the real world and make a difference for people at risk of lung cancer. Seamus also brings his lived experience as someone who's been diagnosed with lung cancer and has gone through a clinical trial. And I really feel from both of our perspectives, we really bring a richness and a real worldness, even though that's not a proper word, to it. And hopefully you can see that reflected then in the Lung Health Check programme. So lay communication for the general public is really key when you're looking at a programme where you're trying to get people from the public to participate in something like a lung health check programme. And when you think about the lay public, you have to have images that are accessible, you have to have information that's understandable, and you have to have information that doesn't overload someone so that they're reading through and they're like, oh my goodness, I can't even remember what the first paragraph was now. So it's really about making it so that it's easy to digest, easy to understand, but then also that people are very comfortable in saying, I've read that, I'd like a little bit more information, could you help me with XYZ? And that's why these patient engagement evenings are so important, because it gives that people that opportunity to ask any questions or anything they may have. I mean, I think with lay communication, it's never going to be a one-size-fits-all approach. It's just something that you try to do your best and make it as generalizable as possible for the population in which you're trying to address and try to get to participate in the programme. It is really important to tailor communication when it comes to something like a lung health check programme, because we know one of the issues is that hard to reach population. So it's really, really important to have local champions or people in the local area who can feed back to what might be the issues, problems, whatever it might be. So then you can work on your communications plan and the types of documents or images that might be more welcome within that community, and then how to, bring them to those people as well. Is it sort of social media? Is it radio? Is it print? What might work best? So within the hard to reach population, again, I don't think it's a one size fits all approach. There's a lot of different sensitivities that you have to really bring on board and be very conscious of, but something to help that will have people from the locality in which you're looking to start a programme off in. So it may be, if you have a number of different regions, you may have slightly different documents depending on the region that you're in, because it's all about trying to make people comfortable and make people think, well, this is something that I should take part in if I'm eligible for.